But the average death rate from prostate cancer is 110 a year. Now, if you compare that to the second most common cancer, colon cancer, about 225 people in Barbados every year, of which something like 90 die.
Barbadians, especially men, are being encouraged to get screened early for various types of cancers, as special focus is placed on prostate, colon, and breast cancer, among the most prevalent in Barbados. In 2020, Barbados recorded 279 cases of prostate cancer, in breast 189, and colon cancer 147. However, in that year, there were 137 prostate cancer-related deaths, in breast cancer 111, and colon cancer 78. Professor David Rosin, head of the Barbados Cancer Society, explained that cancer cases have become more prevalent in recent times due to a number of factors.
You know, if you and I were talking 100 years ago, we wouldn't even mention cancer. Everybody would talk about tuberculosis. Who talks about tuberculosis now? Nobody. It's cured. I have a dream that cancer will be cured sometime in the near future soon. But in the meantime, we have to discuss what we can do, especially here in Barbados, for people who not only have cancer, but if we can prevent them getting the cancer increasing, or if we get it at the very early stage, we can treat it much more easily, less aggressively. And we have to think of the predisposing factors as to why people are getting cancer. You know, I was born in Africa. I'm a true African. I was born in Zimbabwe. And when I was a student, I never saw patients with colon cancer. They didn't have diverticular disease or hemorrhoids or appendicitis even. Why? They had a very, very healthy, high-fiber diet. If we look at the population in Barbados today, your grandparents never got cancer of the colon or diverticular disease or hemorrhoids. Why? They had a very high-fiber diet. If we look around today of the diet that's happening in so-called first world countries, the diet is low fiber. It's fast food and things like that. So here we can immediately start and talk about the prevention of certain cancers. Lung cancer, which is the commonest cancer in the world, thankfully very rare here in Barbados, but the commonest cancer in the world. Why? Smoking. Now that people have stopped smoking in most countries, not in China, not in India, where the largest populations are, but in most Western countries, and certainly here in Barbados, very few people smoke tobacco. And that's why lung cancer here is so low. There are lots of preventive things. I worked for a year in Hong Kong, and the commonest cancer there was esophageal, the gullet cancer. And why? Probably due to pickled vegetables and canned meat, which has nitrates in it. In Japan, they have the highest incidence of gastric cancer, stomach cancer. Why? They eat a lot of raw fish.
Prostate cancer for him is a big concern, as younger men are getting it, and men are usually the ones who are hesitant to get tested. Also, studies show that black men are more genetically predisposed to the cancer.
Here in Barbados, the commonest cancer is prostate cancer, despite only half the population can get it, because women aren't going to get a prostate cancer, right? So we have to really think about how we're going to treat this. Not only is it the commonest cancer and causes the most cancer deaths, but it is also occurs in younger men, and I'm going to talk about the trial. We've shown that it's even down to men of 40. Usually it's a disease of old age, over 60, 65. And usually it's not aggressive, especially in other ethnic groups. But in men of African descent, it's aggressive as well. So it's a double whammy, younger and more aggressive. And it's especially common in families. That's the other thing I should have mentioned about predisposing factors, of course, genetics. Breast cancer prostate cancer, neuroendocrine tumors, thyroid cancer, they all are more common in families because it's genetic.
What progress have you guys made over the years in getting people to come and get tested, being more willing to participate in getting tested, especially for men, because men usually are a bit more resistant?
You are so right. Why are we men so resistant? We think we're macho. We don't like to think that, we might have a disease or anything like that. So men don't come forward. I mean, there's a simple way of finding testicular cancer just by examining the testicles. Now, that's not a common cancer, but we offer that service as well as screening in a younger man. If you feel a lump in your testicle, you should come and be seen. So with the prostate, I believe that we should probably start at 40.
Improved screening and clinical trials have allowed the Cancer Society to get a better understanding of the types of cancers in Barbados, and new forms of testing has allowed them to know at an early stage if someone can develop cancer.
And I said we lead the field because we've just completed a trial of 565 men here in Barbados from the age of 40 upwards, and we found with a DNA molecular signature, right? And we tested it against the routine test that everybody uses, which is called a PSA, prostate-specific antigen.
What was the outcome?
The outcome was that of these 565 men, 80 had a positive molecular signature in the blood. You might say to me, okay, Professor, what's a molecular signature? It's a DNA-based. It's just like if you wanted to know the heritage of your family, the background, you could have a saliva test or a blood test and send it off, and they'll tell you. They'll even find your relatives. We're now finding it's called genomics in medicine, that certain cancers there is a molecular signature in the blood. Little as 2 milliliters, small 4 drops of blood, we can test. And that's what we did. So we did this trial, and there were 80 men. Now, of those 80 men, 20 had, I think 24, had cancer before of the prostate or were being treated. So obviously their signature was positive. But what was fascinating was that 76 out of 80 had normal PSA, right, test, no symptoms, none at all, no signs when you examine them, and nothing on imaging. They have this molecular signature in their blood. We now know that these men are going to develop cancer of the prostate sometime in the future. So that means we can watch them extremely closely. We're going to see them every 6 months. And as soon as it shows up at all, we can get onto it, and they can have treatment which is so much less aggressive.
In this study you guys did, it seemed as this is not regular. This type of
no. I mean, you can. I mean, now there are companies who are selling it. The fact is that it's $500 a test for these tests. There are 5 or 6 cancers that can be tested: lung, breast, prostate, colon, and neuroendocrine tumors. We have, having done the trial and found these men with the help of Wren Laboratories in America, they did it for free for us, for the trial. So none of our participants actually paid for the test. They had to pay for the PSA, which was done here in Barbados. Because I want to follow up these people, the 70 who have the positive molecular signature, I have now an agreement with the laboratory that they will actually do it only for Barbados at $195 compared to $500. So we are able now to offer that for them and for other people. In fact, the ones on the trial are still getting it free. But if somebody like you, say you wanted to come and have a test, I can get it for you, or we can here at the Cancer Society, through our agreement, get it for $195.
And this testing in comparison to the other, what's the cost difference?
Well, I mean, a PSA test is about just under 100 Barbados dollars. So we're talking about 3 times as much. But the PSA has false positives, false negatives. You can end up having a positive PSA because the prostate's just large, or you've had an infection in the prostate. That can't happen with a molecular signature. It's specific for cancer.
Another clinical trial of 600 people is being done, this time on colon cancer. And Professor Dr. Rosin says they're in need of volunteers.
So the next trial, the colon cancer trial, we're going to look at what the normal testing is done across the world. And the test that is most often used is called the FIT test, F-I-T, which is a testing of the stool. Mm-hmm. Now, we're going to look at that compared to the molecular signature test, which you take a little bit of blood. If you were a patient, just put yourself in somebody who comes and says, okay, I'd like to join the trial, or I'd like to know about whether I've got colon cancer, my uncle had it, or my aunt had it, or my father. In my family, my brother had cancer of the colon, and I've had a colonoscopy every 5 years since. Every 5 years. Now, there aren't enough colonoscopists in the world, certainly not in Barbados, to be able to do a colonoscopy. They can just about manage what they're doing now. So to actually, as a screening test, colonoscopy, sadly, it's expensive, time-consuming, and there aren't enough people to do it. It's not possible. It's not possible, and I'm not just talking about Barbados. It's not possible in any country.
How does one be a candidate selected?
Oh, it's anybody who comes forward,
okay,
who's over the age. Obviously, if they've had colon cancer, they can still come because, as I said, the test can show progression of disease.
Is there any incentive?
But it's better. But we want the majority to be people who don't think they have any problems. The final words. My hopes and aspirations are that for the foreseeable future, we will get cancer earlier and earlier here in Barbados, especially where we have a population we can follow easily, and it's not a huge population, 285,000. It's not like, the problems in China where you're looking to screen 1.4 billion people, or in India. So it should be very easily manageable. And I think that, as I've said time and again, the earlier you find cancer, the better the treatment, much less aggressive and much more effective.